This is sort of a difficult panel to be on for a variety of reasons. One is there are a lot of us, and we weren't quite sure what any of the others were going to talk about. We sort of had some general ideas, but, you know. So I was going to focus my presentation on the fetal anomaly bill, the Down syndrome bill, and sort of what I think about it, not so much in terms of law, because I do think, as both David and Jesse said, it's unconstitutional, but sort of think about why we want to, or why we sort of are going that way, thinking about sort of these motive bans, banning abortions based on the motives of the parent. But then, as I'm sitting here and listening to both Jesse and David, you know, I had lots of other thoughts that don't have anything necessarily to do with what I was going to talk about. So a couple of things. Potential life. David said either you're alive or you're not. And I think, you know, it's a difficult thing to sort of think about potential life. My daughter Morgan always says an acorn is not a tree. It's how sort of she understands potential life, right? There are phases, and do we treat the acorn in the same way that we treat the tree? And maybe that's trite, but that's sort of helpful to me in sort of thinking about life and the potentiality of life. We're going to disagree about that lifeline, when life begins, right? That in large part it is a sort of moral or religious decision. Science doesn't really tell us when the human embryo becomes alive, because being alive is a social thing, right? You know, what makes a human human? I hope it's not sentience. I mean, some people have thought sentience. But, you know, babies aren't sentient, right? Babies don't, like, know that they have hands. So sentience is not quite the place. But where do we put that line at where the thing becomes something that we protect and view with rights? And so viability, while I agree with David, is a fuzzy line, it is a line that sort of respects plurality of moral views about when life begins, but it also respects the bodily integrity of the woman who might be carrying the fetus, right? Because I think in some ways it is a matter of geography, right? That do I have a right, or do I have ownership of this body of mine? And if I don't have ownership of this body of mine to do what I want, does that look more like slavery than not? Right? So anyway, so those are some thoughts. The other thought I had about viability is, again, about David's point, that viability is a really fuzzy line, but I think it's the only one we have. And currently, at least, you know, the last issue of Pediatrics I read, and yeah, I read things like Pediatrics and the Journal of American Medicine and things like that, says that really the outer limits of viability are about 23 to 24 weeks. We really can't push viability any further, but we've sort of still got to think about what we think, what we mean by viability. A chance to live outside of the mother's womb. I don't even sort of use those words in real life, right? Do you use the word womb in real life? You might, but I don't. You know, I taught my children to say uterus. I don't know. But anyway, that's another story. What sort of chance? Is a 5 or 10% chance enough? Should 30 to 50% chance of living outside the mother's womb be required? Or should viability be something that has to do with having a long-term chance of survival? But even if it's a long-term chance of survival, how much of a chance of survival, right? So those are all really important questions. And viability changes. Even though we think we can't push viability any further than 23 or 24 weeks, even a 23 or 24-week-old fetus might not be viable because there are other things other than fetal age that determine viability, like weight, like maternal health, like maternal nutrition, like the availability of medical specialists who can then take the fetus out of the woman's body and then save it, right? So what kind of hospital you might be at when you deliver a 23 or 24-week fetus has something to do with whether or not that fetus ends up being viable. So viability is important. We've got to think about it. And the other thing, so that's one thing. So I wanted to talk about potential life. An acorn is not a tree. Viability is important, but it is this fuzzy, vague line, but nevertheless important. another thing I want to say before I start talking about the fetal anomaly bill is about 20-week bans. One of the things that Jesse said was the 20-week bans, the 20-week abortions don't happen much in Ohio. But where they do happen, they disproportionately affect young women, poor women, and women of color. They disproportionately affect young women because young women are less likely to know they're pregnant, right? Because we remember from health class that young women don't get their periods on a regular basis, and so it might be a while before a young woman knows that she's pregnant. Poor women, and then young women, because I assume that all young women are poor, right? That most young women don't have full-time jobs. Their parents may, but that's their parents' money, not theirs. One has to gather the money to have an abortion. And $500 might be a lot for a first trimester abortion, but it's more money than young women or low-income women or poor women have, right? And so the longer it takes you to get the money, the more likely you are going to be then be in a situation where a 20-week or more abortion is the only option you have. So we want to think about that too, to the extent that some of these bans disproportionately affect populations that are already disenfranchised. Okay, so I was going to talk, so that's all I have to say about everything else. Do I have another couple minutes to talk about the fetal anomaly bill? Okay, so the fetal anomaly bill, I know some of you have read it. It's pretty interesting. There are lots of penalties. There are criminal penalties for doctors, there are professional penalties for doctors, there are civil penalties for doctors, and there is even a space for an equitable remedy. So physicians who have reason to believe the child, the unborn child, the statute says, has reason to believe that the unborn child has Down syndrome, can be subject to these criminal penalties. And why might they have reason to believe that the fetus has Down syndrome? Prenatal testing, a prenatal diagnosis of the fetus, or any other reason. So I think doctors should worry about being sort of caught in that web. And doctors also have to certify that they didn't know whether the patient was choosing to terminate the pregnancy due to Down syndrome of the fetus. There's professional penalties, losing your license, okay, etc. So here's the problem, I think, as often discussed in public. We know that Down syndrome is this genetic condition. It's caused by an extra syndrome, and that it can present with varying severity in people. Right now, there are about 6,000 babies born in the United States each year with Down syndrome. That's about 1 in every 700 births. And the information I found, which was from 1995 to 2011, this one study found that between 50 and 85% of pregnant women who receive a positive result for a prenatal screening for Down syndrome terminate their pregnancies. So we're talking about small numbers in some ways, but a lot of people in others. The argument we most often hear in public about bans like this fetal anomaly bill has to do with eugenics. And David sort of talked a little bit about this, too, that this statute is protecting disabled people from being discriminated against, that we shouldn't have a society where we choose to value some traits over others. And so the discrimination part is that by encouraging or allowing women to terminate fetuses with Down syndrome, society or the state or we all are attaching less value to people with Down syndrome. Specifically, we're attaching less value to people with Down syndrome specifically, but we're also attaching less value to people with disabilities more generally. And then this in turn leads to discrimination against those people living with disabilities. So a ban on abortion like this would work to encourage greater valuation of people with disabilities and in turn lead to less discrimination against people with disabilities. That's sort of the public side. In private, I have been told, and I think actually, even newspaper accounts bear this out, that the real motive for these bans, as Jesse suggested, is to limit women's access to abortion and to really not just whittle away, but destroy whatever protections that women currently have to access abortion. So this ban is all about Roe v. Wade. What do you think about that? So that's the law. Well, what about the ethics? I've been trying to think about this within a particular school of analysis called reproductive justice. And reproductive justice is a school of thought that really was defined by women of color, and it thought about reproductive rights as human rights. So that when we talk about reproductive rights, we're talking about human rights, or we're talking about reproductive justice. And the focus of reproductive justice is not just access, not just about choice, it's about access, and access to a full range of life experiences. When to have children, whether to have children, getting medical care in a respectful way from your chosen practitioner. So reproductive justice is not just about abortion, although abortion is critical. And we want to remember that women of color across the economic spectrum have less access to contraception, comprehensive sex education, STI prevention, alternative birth control methods, prenatal care, pregnancy care, domestic violence, adequate wages to support our families, safe homes, and so much more. And it's in this context that I think we have to think about abortion bans. That if we really care about disabled children and disabled people, we would be treating their mothers better, right? That we would somehow develop public policy that would ensure that those children who are born healthier. For example, women of color and poor women have children who are more likely to be disabled because they're more likely to be subject to toxins in utero. Lead, right? We know lead, right? Lead is one, but environmental pollutants as well. In addition, these are the same families that are less likely to have access to prenatal care and subsequent health care. So I think it's sort of bad faith to say, we're going to stop discrimination, or we're going to do something about discrimination against disabled people without changing the conditions under which women make these decisions. That women might make different decisions about abortion if they had support. And I'm talking about state support. You know, the more wealthy among us can hire people to take care of our children. And if any of you have children with any kinds of disability, you know that children with disabilities are expensive. You know, believe me, I know. And for people that have some money, you can hire people to sort of meet their needs, take care of them, and sort of go on with your life. Poor people don't have that option. So that's the context, that's part of the context in which women are deciding whether or not to carry these pregnancies to term. So that's the ethical dilemma for me. The ethical dilemma is the public policy that limits government expenditures for support of children and families. Can I say something else? Or am I done? 2 minutes. Okay. So, and for those of you that don't know anything about the types of supports that are available to poor people, they're quite paltry. They're quite small. So, again, if we really care about disabled people, then what do? Do we ban abortions? I don't think so. I think we figure out not only how to improve the lives of women who make decisions about abortion or no abortion, but also we need to improve the lives of people with disabilities. We've got to provide people with disabilities access to better health care, better education, employment, housing. Because part of what that woman is deciding when she decides to terminate a fetus based on the fetal anomaly is what kind of world that fetus is coming into. And it's coming into a world that refuses to provide for its needs once it's born. So let's care about children, let's care about adults, let's develop some comprehensive support services for disabled children and adults and their caregivers. I think that is sort of a better way and a more honest way to deal with the issue of disability, unless we're not talking about disability at all. And if we're not talking about disability, then we need to be honest about that too. And I think that's all I have to say.
Ms. Parker, Ms. Starr Parker.
Thank you. As you heard, my name is Starr Parker. I'm the founder and president of CURE, the Center for Urban Renewal and Education, based in Washington, D.C. We're a policy institute where we actually fight poverty to restore dignity through the message of faith, freedom, and personal responsibility. I'm here today to declare my support for ending legalized abortion in America. I have a lot of little questions for you, but I'm going to start with one, and that is that as it is the middle of April, what is up with the snow? I'm glad I hadn't packed away my coat yet to get here to be with you this evening, but I am glad that I'm here. Because as in when ending slavery, there was great debate in America. Ohio was at the forefront of changing its laws toward consistency with our U.S. Constitution. So I'm honored to be with you today, while, again, your state is at the forefront of national debate regarding abortion, as it, too, is inconsistent with our nation's founding principles. Abortion is not salvation. Abortion is a crime against humanity, so America should not be doing it. In addition to the moral implications of abortion and its mental and medical complications, legalized abortion has fed into a narrative in this country of victimhood, as if women have no control over their sexual impulses. So thus, as a result of this narrative, abortion in our country has not only become an extension of government welfare programs, but it's become birth control in many of our nation's most vulnerable communities and for our most poor and educated. African Americans have been specifically targeted with this narrative and thus have been hit the hardest by these two factors. 5 years after Dr. King's death, Roe v. Wade became national law, and the number of black abortions in America is heart-wrenching. The average is 1,200 a day, 30,000 a month, 400,000 a year, 18 million since Roe v. Wade. Is it any wonder that our nation's most distressed zip codes are drowning in moral madness? The abortion industry all across America preys on our nation's most vulnerable, brutally dismembering their offspring under the guise of helping the poor. Hiding behind words such as choice and reproductive rights, the abortion industry has promoted laws of destruction and has caused great pain in the aftermath. Recently, a famous rapper named Nicki Minaj told Rolling Stone magazine that her abortion in her youth still haunts her. It's a heart-wrenching story being told by thousands of distraught men and women all around this country. I was once such woman when years ago, lost in sexual recklessness, had 4 abortions without any counsel or information from the abortion providers about the distinct humanity of the life that was growing within me. I heard all of the propaganda of the abortion peddlers in school, in media, from communities and political leaders, yet I heard nothing of infant development in the room, nor any information about their mortality. I did not receive information about either the potential complications by which I may need emergency care that may not have been available through these abortion clinics, which is something that you have been debating here in Ohio and moving laws toward protection of those that are going into these so-called safe, legal, rare abortion clinics. Perhaps then, when I was having my abortion in the 70s, one might have been able to argue that little was known about development and mortality. And so that fetus or that embryo could be exterminated without much information. Very few instruments were available to medically or scientifically detect that humanity. But today, due to modern technology, this is not an argument that can be made, in particular with the advent of ultrasound, where we can now measure brain waves and heartbeats within the womb. To illustrate examples of the pain the abortion industry is causing on a personal level for countless Americans, I want to share 3 stories that I have heard about the impact of abortion on these fellow citizens. Number 1, in Texas, this man had deep regret of an abortion in his youth after the discovery of information on fetal development upon his wife's first pregnancy, and he ended up in counseling for depression. When he saw the heartbeat of their unborn child and expected offspring on sonogram, his heart rushed with panic of an abortion he had decades earlier with a girlfriend. In North Carolina, This couple talked themselves into an abortion for financial reasons, and then they couldn't look at each other again after thinking about fetal development, and then they ended their marriage. In Alaska, this pastor found out that his minor daughter had had an abortion without consent after she was in agonizing pain, and then she was rushed to the hospital, and then he found out that she was carrying twins, and the abortionist only killed one. I commend all of you Ohioans who understand the humanity of the fetus and your attempts to protect this humanity through the passage of various laws in your states. Another question I have for you today, outside of your weather, is what is our civic obligation to the millions of men and women all across this country who go into an abortion clinic with very limited moral and mental and medical clarity? Another suggestion for us to ponder as we go into a debate during this 50th anniversary year of slain civil rights activist Dr. Martin Luther King Jr. is the last time in American history we were faced with hard constitutional and political questions. Questions on the civil conflict between humanity and convenience, personhood and property, justice and public opinion. As we debate these questions this evening, we should remind ourselves that these same questions divided our nation during slavery. And similar emotions and tensions were present then as are in the room today, and as are in our public square, and as are in our law, concerning who qualifies for natural rights worthy of protection. For the first 89 years of our nation's existence, it was a black slave who sought freedom and equal protection under the law, and many attempts were made to heed their cry. In 1777, gradual abolition laws were passed in northern states, states like Vermont, Massachusetts, New Hampshire, Pennsylvania, Rhode Island, Connecticut, New York, and New Jersey. In 1807, Congress passed a law prohibiting the importation of slaves into the United States after January 1st, 1808. Ohio banned its slavery in its constitution in 1802. Today, it is the conceived person living in the womb of its mother that should be considered human with opportunity and equal protection under the law. It is ironic that while in 1868, the 14th Amendment to the U.S. Constitution humanized slaves, that in 1973, the United States Supreme Court dehumanized the life in utero in the womb, handing down a decision that's reeking in ethnic cleansing, as you've already heard from other panelists, to once again allow the powerful few to determine exactly who has a right to humanity. As with slavery, special interest groups put tremendous pressure on legislators and on judges to dehumanize blacks so to protect slavery. Today, special interest groups put similar pressure on legislators and judges regarding abortion. I'm so proud of you in Ohio who would ban abortion after what you may call 20 weeks, but we should say out loud that that's 5 months of pregnancy. If the fetus in utero is not a human being in the fullest sense of that term, then he or she has no natural right to life. However, if the opposite is true, that the fetus indeed has uniqueness and distinction, then the humanity of that human in the womb is entitled to a moral and constitutional right to life, including those growing to be born in the great state of Ohio. Thank you.
Thank you, Ms. Parker, you just discussed targeting of communities of color by abortion clinics. And I wanted to look at maternal health for black women broadly and ask you about how you think that fits into that. So in the United States right now, a black woman is 243% more likely to die from pregnancy or childbirth-related causes than a white woman in this country. And this is true even when we control for economic variance. So I'm wondering how you think abortion might fit into that context.
I believe that abortion is a crime against humanity, and I believe that during slavery, more black women probably died because of slavery than white women.
And, you know, I think motherhood is socially constructed. So when people become mothers, when people think of themselves as mothers, changes, right? It can change throughout the pregnancy, it can change. It can change throughout the pregnancy, it can change throughout the life, a woman's life. So I don't think anything is cut and dry, as you suggest it is. It might be true for you, and I respect that, but it's not true for all women. It's not true of all women, that's all.
This is a new marketing campaign from the abortion industry to convince black women that they are better with a dead baby than a live baby. And it's a bigger reason for them narrating this way. Number one is because the truth is getting in the black community that they have been specifically targeted for abortion by the likes of Planned Parenthood was founded by eugenicist Margaret Sanger. So since this messaging is getting out in black communities, and black women are very thoughtful now going into this so-called decision of choice and reproductive rights, but also that particular community, the pro-abortion community, is wanting these numbers to stay low in the black community, so therefore they are now messaging differently to tell black women that the children growing in the room are health risk, and there are no health risks to abortion is their narrative, so therefore you should kill your child rather than produce it. Planned Parenthood on Halloween actually sent that messaging out into the public.
You know, I don't know that it is meant, right, as an attack on on women of color and other black women. But I do think it's important to note that the reproductive justice movement is a movement of women of color. It is a movement led by women of color and poor women, but women of color, and they have brought traditional reproductive rights organizations along, right? Traditional reproductive rights organizations were all about abortion. Reproductive justice is about, can we let us be fertile? Let us have babies. Let us keep our children and raise our children. And when we don't want to be pregnant, let us have safe access to abortion. It is a more comprehensive sort of vision about the role of reproduction in a woman's life. And that is led by women of color, particularly black women. Sister Song out of Atlanta is, you know, if anybody's interested, look them up. So I want to push back from the idea that sort of black women are being led astray by these white women who have some sort of weird control over us. The last white woman that had weird control over me, I think I was in 4th grade, right? So I want to sort of be respected for that, for our ability to disagree, but also to sort of think for ourselves.
Hi, my name's Emily. I have spent the last 9 years working in the state of Ohio with women who are impoverished. Hello. I haven't seen you this whole time. And primarily with women who are low income, who have suffered from domestic violence. We all know, I don't think this is up for debate, that women are disproportionately affected by poverty. In the state of Ohio, 1 in 6 children live under the poverty rate, and in Cleveland, it's the majority of children. So for the 3 of you that have self-identified as pro-life, I'd really like to know if you are in favor of some of the proposed legislation right now. For instance, there's a bill on the floor of the House right now that's being debated about restricting access to food stamps, which is proven to disproportionately affect children. I'd like to know if any of you are aware of that, if you could speak to your work, your anti-abortion work, by eliminating poverty and some of the other factors that come into this, because frankly I feel like it's really missing from this conversation.
So if you're talking about the farm bill that's being discussed in the United States Congress, or are you talking about your local legislature? The farm bill discussed right now, and the restrictions that are being placed on those that are recipients of food stamps. Yes, there is discussion right now in the United States House whether there will be the opportunity for states to add work requirements for able-bodied. Did you? Okay, but then you answered your own question, so you already knew the answer, so you didn't need to ask. I thought you wanted to know the answer to that question. But to your first part of the question, which you might know the answer to as well, there is also discussion about that $520 million that Planned Parenthood receives from the federal government, so that then they can do their marketing campaigns to create an environment to where black women think that their children are better off dead than born, diverting that $520 million into centers that will actually help alleviate poverty in other areas. So yes, that discussion is taking place, and with the new administration in place, it will probably pass. One of the executive orders that was just passed this week, written into law this week, includes those opportunities not just for the 13 different agencies that house anti-poverty money, to get much more creative about how they are going to work out programs that will positively impact those that are in vulnerable zip codes, but also to give more flexibility in the states for them to do the same.
I just want to clarify, because a lot of times this is a common misperception. There has been a work requirement for food stamps for able-bodied adults since the 90s. So what I was specifically correcting you on was the addition to an additional 5 hours every week.
There have been work requirements, and different states implement according to their state desires. You're absolutely right. But there will be an expansion, and much of that expansion discussion is not just in food stamps, but also in Medicaid, because the way that it's currently designed, you're absolutely right, you can add work requirements as a state, but the way that it's currently designed is your state has to come and ask for waivers from the federal government. What we're trying to do is get rid of that middleman attempt and allow you more flexibility and mobility in your state to work with your most vulnerable. So you're absolutely right. In current law, states do have opportunities to say, we would like to add work requirements to able bodies, whether they're receiving Medicaid and or whether they're receiving, now we'll be entering into the debate on food stamps. But that's very different, what the new suggestions are, because they're about getting rid of the waivers.
When we can test for genetic conditions such as mine, which caused me to be a blind man, or somebody else's that may cause them to be predisposed to ALS, or have autism, or any number of these disabilities, where do we draw the line? Because personally, I think what we're doing is we're taking the right to life away from the most vulnerable, and we're making decisions about a community we really don't know anything about. I don't know what it's like to be an autistic child because I'm not a member of that community. I can't experience it through their lives. I don't know what it's like to be a black man or a white woman because I'm a white man. So we need to take a minute and actually look at that. And where do we draw the line? And I want to know from the panel, where do they think we should draw the line for the slippery slope of what's acceptable eugenics, for lack of a better term, because that's actually what it is. Thank you very much.
I think that we as a society should ask ourselves, is abortion a crime against humanity? If this is a living being, then there should not be a line between life and death. What we should do is agree as a society, before we get to the place where the agreement was made for us outside of our ability, what happened during the Civil War, we should get to the place where we agree that abortion should not just be illegal in this country, but it should be unthinkable.
I'll have